Big news. I have some important news for you.
Interesting news.
It's Blake and Darren's Spilling the Tea with Sandy.
K-Man's top news headlines of the day from CMR.
Good morning, Sandy. How are you? Oh, I'm not hearing you for some reason. 1 2 1 2.
Hey, Blake. Good morning.
Oh, there you are. You turn their mic on?
Yes. There's more than one area to mute it is always the problem. So sometimes it's muted in one area. And
Good. Figured that out. So what's happening with headlines this morning?
I know. Give me one quick second. Actually, I just need to adjust it. There we go. I think we should be good.
Yeah, you sound fine.
Awesome. All right. So good morning. Good morning.
Good morning. Erin's off today again. She's a little under the weather.
She's really milking those days off, I think.
Right? She deserves it.
Yeah. You need to have a word with her, though. So quite a bit happening in the world of news today. Not the best news to report this morning, but unfortunately there was a shooting incident last night where a retired officer actually lost his life. A retired prison officer lost his life in a robbery. Yeah.
You're kidding.
No, it's pretty crazy.
That's very sad. What were the circumstances around the robbery? Was that
illegal numbers? Illegal numbers.
What do you mean?
People sell numbers illegally here in the Cayman Islands, gambling.
Yeah, I've heard that.
So the gunmen were trying to rob the number seller, which is something that happens quite a bit actually because they're an easy target. And he was an innocent bystander. He was just there buying numbers and got caught up in the situation.
Wow. I mean, typically you don't hear about shots being fired. You hear people brandishing a weapon.
Yeah.
And thankfully you don't often hear that they actually pull a trigger on that because it's just used as a means to get what they want. Any reason why that happened that way, that went down last night?
I think that there's always a chance during a robbery that something is going to go wrong. And I guess that unfortunately last night was it.
Wow.
Really sad. Yeah.
Where did that happen?
Eastern Avenue, close to School Road.
Oh, no kidding. Just right over by Broadcasting.
Yeah. Not right around the corner, literally.
Wow.
Yes. So our condolences to the family. And in other news,
did they get the person?
It doesn't seem so. There's more than one. So we've not heard anything from the police actually on this as yet. But our street sources have said no one has been arrested.
Well, you finally heard from the police about the robbery in West Bay.
Yeah, yeah. 7 hours later, but we did.
And what were the circumstances there? We didn't really mention it yesterday.
So some men went and robbed the Domino's Pizza in West Bay. That's the one that's close to the Ed Bush Field. And the interesting thing about those robbers, it appears that they were hungry because they demanded pizza at the time of the robbery, which is a bit unusual. But again, we see some of these robbers getting a bit more brazen and violent because then they pistol whip the staff after they got the pizza. I'm thinking, didn't you like the pizza? Did you want extra pepperoni? Like, come on.
Wrong toppings.
Yeah, it's just ridiculous.
Oh man, you don't want to hear that though.
Yeah, for sure. So, in other news, the government has indicated, that because of the data breach that we saw back on, I think it was the 12th, it has come to their attention that there are definitely some people who've been defrauding the government. So, I mean, it's amazing that it has just come to their attention, but nonetheless, people have been making these allegations for quite some time. But I think once everybody was able to see the list, they started outing each other, including family members. They're like, oh, that person's been working, or, oh, that person's never worked in tourism. So there was like 4 people on the list who were incarcerated. One was incarcerated at the time that he submitted his application.
Wow.
So they're asking the police to look into this with a view to potentially prosecuting people.
Obviously there is the honor system a bit for these kinds of things, but people are always going to take advantage of the system. So why isn't there somebody that is double checking this kind of thing? I mean, you can't adopt a cat or a dog without people coming to your house to check on you to make sure everything, the home is in order. It's a nice home. What you're saying is accurate. Isn't there some sort of vetting process that goes on when you?
No, I think unfortunately the last administration didn't necessarily put those protocols in place. Partly because of the necessity to get people who needed it the most the funds, and so it was just kind of a free for all. And like you said, there's always going to be those few bad apples that really take advantage of the situation.
Well, anytime the government's handing out money, no matter which country you're in, people are going to have their hand out.
Yeah,
You know what I mean?
it's unfortunate.
No.
And so that'll be interesting to see how that develops. We'll keep everyone abreast of that. The Deputy Premier, Mr. Chris Saunders, has now tested positive for COVID. So
Yeah,
just a
for that.
reminder to everyone that the COVID numbers, the daily numbers are increasing. The government's actually working on some updated regulations. No, they're not going to remove masks yet, but they're going to increase, I think, the numbers in the outdoor space and a few other things, but they're very, very cautious because the numbers are trending upward again.
Do you have a number count on this? We haven't looked at that in a while.
I know, neither have I, to be honest, but the general consensus is that the numbers are definitely going up, and
Okay.
the medical profession, the chief medical officer is watching it with a keen eye.
Okay.
Elon Musk in international news is going to buy Twitter for $44 billion.
I heard that.
The deal dropped yesterday. The details, a little bit of the details. It's now going to become a private company once the purchase is completed. So super interesting that has happened, because there's a lot of things going on in the last couple of weeks with him, and especially last week with Twitter.
That's $44 billion is a lot of money. I don't even know where you get that. Does he even have $44 billion? That's
I guess
a billion is 1,000 millions. So
yeah, it's crazy. You and I will never see that.
That's a lot of millions. Anyway, it's kind of scary to see what he's going to do with Twitter, because his whole thing is like, they're not allowing free speech, and because a lot of the social media platforms are kind of monitoring just again, bad apples who put out hate speech and things like that. So you wonder what he's going to allow. Is he going to allow, here's a perfect example, former President Donald Trump. He's going to allow him back on Twitter, let him stir the pot, and
I don't know, but it's 7:30, so I gotta go.
Yeah.
I gotta go.
Good call. All right. Catch Sandy right now on Bobo 89.1 FM. We'll see you tomorrow. Okay.
All right. Great. Thanks. All right, folks. Let me get in there quickly. There is a time limit here.
Peppermint, sorrel, ginger, beaver grass, or English. Get it ready. Your morning tea just got hotter.
Ooh, honey child.
On the cold, hard truth. Bobo 89.1 and Cayman's #1 talk show are bringing you morning talk like no one else. Monday Rewind, Impact Wednesdays, Caribbean Connections, and much more. Don't miss a beat with what's happening in the local community. Just keep sipping your tea.
What a mess.
Here's your host, live and direct from the Cayman Islands, Sandy Hill.
All right. Good morning. Good morning, everyone. Welcome to the program. So good to have you guys up bright and early with us. Thank you guys so much for tuning in. Miss Sue should be happy this morning. I am back with full video. So super happy to be here. Of course, we've got lots to discuss this morning. It is Tuesday, so that means that it's Rundown Tuesday for the first segment of the show. We're going to be talking with our friends over at Health City. And then after the program, make sure you tune in for the entire show, because, gosh, we got a lot to talk about today, including this very, very unfortunate situation where a retired prison officer has lost his life. Oh my gosh, it's so shocking and so unbelievable. but we'll give you all the details. And we actually have an update with the Cuban migrants as well. So something that you guys might find incredibly interesting following our discussion yesterday morning. So we are waiting on our guests to refresh their feed just a little bit, because for some reason it says device is not connected. But let us go ahead and say good morning to everyone. So good morning to to Irvelin, my apologies. Good morning to Rita. Andine is here. Olivia, Miss Barbara, Virtuous is here. Vale, buenos dias, ¿cómo estás? We have OCM Production says good morning, tuning in from Los Santos. Los Santos, ¿dónde está Los Santos? Los Santos, where is that? Is that Honduras? Linda is here. Good morning, Sanya. Good morning to you. Sanya says a good man has been cut down, and maybe he knew that animal who's robbing. God is watching. Condolences to his family. So yeah, we're going to get into some of those details this morning to let you guys know what we know, and then we'll take it from there. All right. So good morning to all of you this morning. It seems okay. Good morning to Louis joining us. He says, good morning, CMR family. Diamond Princess is here. Wee Miss Beulah Walton, Aliano from Georgetown Central. No, you're from Windsor Park, Georgetown. Giovanni, good morning. Marshall from North Carolina. Everton is joining us as well. And of course, Miss Iva is also here. Miss Iva, how is your mango tree looking? Let me know. Right. Okay. We are just waiting on our guests, I think, to sort out a few things. Not sure what's happening with the connection. But we shall try to get them underway here shortly. So what an interesting last couple days. We do have an alert that's going out this morning. Someone has stolen a vehicle. So we want you guys to keep an eye out for Mazda MVP. Let me try to find out what year this is. The person says that it has a significant dent over the right tire, and they're pleading for anyone. It was taken off of Old Crew Road this morning, and they're pleading for anyone who might have some information on the stolen vehicle to please contact the police, 911 right away. Hopefully they won't take 45 minutes like last time, or 3 hours when the other car got stolen last week that was then used in a robbery. But yeah, I think people gotta make it a priority when they when they do these things. So Sharm, good morning to you. And we have Richard also joining us. Good morning, Sir Richard. Omeria is here, says, what a morning to wake up to, unfortunately. Cameron, good morning to you. And Luis is here. So we do have our guests who are joining us from Health City this morning. So we're going to grab them here in just a quick second and welcome them to the program. We got a really important discussion here this morning. I think that, a lot of the health topics that we cover are incredibly important. And, we have to ensure, that since we're speaking to the experts, we're getting all of this really up-to-date and valuable information, which is beneficial to everyone, really. So make sure that you tune in on Tuesday mornings for Rundown Tuesdays. And this morning, we're going to be talking about breast health. It's one of those things that a lot of times I find we don't necessarily discuss until something has happened. And I think it's great when we can, sort of think outside the box and ensure that we are prioritizing all aspects of our health. So I'm super excited to be having that discussion this morning. So we'll just give them a few more minutes. I can see that Tiffany is ready and set to go. And I think it's just Miss Rajmi, Dr. Rajmi Sharma, that needs to get sorted out. And then other than that, we are going to be hitting the ground here running in just a quick second. All right. So what an interesting show we had yesterday, by the way. Very, very interesting. And sometimes we don't have all the details for you guys, by the way, when we're doing a show. And so I like to do a lot of follow-up in case you guys haven't noticed, to ensure that we are getting the accurate information as it becomes available. So quite interestingly enough, yesterday, after I did some follow-up regarding the Cuban migrant situation, there were some more details that were definitely highlighted in terms of what is being done about that situation. And all of you will be happy to know that something is actually being done. All right. So Kenroy, good morning to you. John is here. Miss Bonnie is here. Thank you, Miss Bonnie, joining us from East End. Carmelie, good morning. And Jonathan also joining us this morning as well. So folks, don't forget that you can call into the program anytime at 936-2626. That's 936-BOBO. Super easy numbers, folks. And, we're always delighted to have you call in. The phone lines are open at any time to entertain your questions, comments, and the like. All right, Miss Tiffany, we're going to be bringing you up here in just a few. Good morning to Charm. Kenroy is also here. And we've got John. Did I say good morning to John already? I think I did. Oh, John, it says your reporter is here. Oh, was that you? I didn't know that was you. Good morning, Scott. How are you? Every time I see Scott, I have this overwhelming desire to eat waffles. Scott is from Waffle Monkey, and can I tell you, the smell of that place when you walk in is amazing. You just want to pick one of everything on the menu. Good morning to Sue. Felicia is here. Miss Della and Cameron says, get your commissioner on the horn. The Cayman community is having serious concerns regarding crime. We're going to talk about that in the second half of the show as soon as we get going here with our rundown segment with Health City. So yes, I think undoubtedly people do have concerns, and some of the concerns, it appears, is lying at the foot of the government, which is quite interesting. And we need to make sure that we understand who's responsible for what. So Malicia, good morning, good morning, good morning. Welcome. How are you? So good to see you. So on today's discussion, we're going to be speaking with Dr. Rajmi, who is now part of the Health City team. She, I think it's a she. I believe it's a she. We'll find out here in just a second. Has just joined Health City recently as a breast surgeon and surgical oncologist. And so this is part of Health City's growing medical team as they continue to add layers to the services that they offer, and bringing on, experts who specialize, I think, in a particular area is extremely important. So Dr. Rajmi Sharma will be joining us this morning to talk about your breasts. And it's important to have this discussion. I feel like a lot of people are sometimes uncomfortable talking about their breasts, but it's part of who we are. It's just like another organ, really. And so, the more you know about breast health and how to look out for certain things, the C word is the one big one that we're always afraid of, but there are other things related to breast health that is extremely important. And, everyone just wants to make sure that you're keeping a good eye on the structure of the breasts, touching them, making sure that nothing has changed in terms of texture or any sort of indentations or lumps or anything else. And men also need to be on the lookout here for those types of things as well, because I know a lot of men think, oh, breast, that's a woman's issue. But, it's everybody's issue, to be quite honest. So let me just show you guys this photo. And I'm going to show you guys this so that we can assist this person in the recovery of their vehicle. And if you know who might have stolen this vehicle, by all means, you know something, as we always say something. Because that's how we collectively can help with crime fighting. It's not just a job for the police, it's a job for everyone. Aquaman is here. Good morning, Aquaman. Says, you know I'm here listening. Thank you so much. Appreciate your support. And Tommy is also joining us. Good morning, Tommy. So good to see you here as well, one of our Caribbean listeners. Okay, I think we're just about almost ready. Okay. All right, so let's go ahead and launch Tuesday Rundown. So, folks, thank you so much for joining this special segment.
For over 7 years, Health City Cayman Islands has provided life-changing and life-saving medical care for the people of the Cayman Islands at our hospital in East End. During this time, we have become an integral part of the community, and now, focused on connectivity and collaboration, our vision is to make an even greater impact on the quality of health care for the people of our islands. In summer 2022, we will open a 70,000 square foot state-of-the-art hospital built on 3 acres of land at the southern end of Camana Bay, bringing much-needed specialized medical services closer to where people live, work, and play. Camana Bay, located at the heart of 7 Mile Beach, is home to schools, businesses, shops, restaurants, and entertainment. And now, Health City Camana Bay, a $100 million world-class hospital. Health City Camana Bay will include an advanced cancer care unit, offering bone marrow transplantation and the latest cancer treatment technology. It will contain a modern neonatal intensive care unit, emergency and critical care, purpose-designed operating rooms for surgical specialties, such as cardiology, neurology, and orthopedics, and robotic operating systems. A master plan for improved health care for the people of the Cayman Islands. Ready to meet the needs of our patients here and now, we have already established a footprint in Camana Bay with the opening of our clinic. Offering short wait times, extended opening hours, including evenings and weekends, and the ability to see our world-class doctors closer to where our patients live and work. The clinic has bright, comfortable waiting areas and treatment rooms, friendly staff, expert care, lab services, and diagnostics. Reflecting our operating philosophy of patient-centered care, convenient access to our specialist doctors allows our patients to focus on getting better rather than getting to appointments. With our unwavering commitment to our community and the thousands of patients who trust us to care for them, we look forward to building healthier communities in a place where life unfolds, blossoms, and thrives. Welcome to Health City Camana Bay.
All right, folks, welcome to Tuesday Rundowns with Health City. So good morning to Tiffany. Good morning. How are you?
Good morning, Sandy. Thanks for having us in the studio with you again. I know that Shamari and Dr. Benoit started off the program with you, and so it's my time to be on air with you for Medical Rundown with Health City Cayman Islands. We Dr. Rashmi was trying to log on, but she's getting an error message for some reason.
No, I see her, so I'm going to pull her in just a second.
Oh, you're seeing her now?
Yeah, she just needs to adjust her camera just a tad.
Okay.
She's cutting off her own head at the top.
Okay. Better. That sounds good.
Yes.
Because she restarted several times to see what was going on. I'm not sure.
Yes, no worries. There
you go. Yes.
Rajmi, good morning to you. Thank you so much for joining the program this morning.
A very good morning to all of you.
All right, so we've
got morning, Dr. Rashmi. Glad you were able to make it on.
Yeah,
Yes,
yeah.
tons of people listening on Bobo 89.1 FM, and then several hundred actually tuned into the show this morning on our social media platforms as well. So let's jump right into the conversation. We're going to talk about breast health this morning, such an important topic. And I feel like it's one of those things that normally we only focus on around October, which is Breast Cancer Awareness Month. But I'm glad that we are addressing this in April, because really your breast health is something that's important all the time. And you
Yes.
shouldn't be waiting just in October to do, breast health examinations or even a mammogram. Do it, whenever you're going to remember to do it, first of all, and make it a part of your regular routine healthcare. So let's talk about, again, Dr. Sharma is a breast surgeon and surgical oncologist that has just joined the Health Cities team recently. So Dr. Sharma, first of all, welcome to the Cayman Islands, and I'm sure you've already had a warm welcome from your colleagues at Health City. Give us an idea of what exactly you do there as a surgical oncologist and breast surgeon.
Okay. A very good morning to all the listeners. I am Dr. Rashmi. I have joined Health City very recently, in 2021 August. And I am a surgical oncologist, means I take care of all the cancer patients. And I am a specialist in breast oncology. That means I deal mainly with breast cancer patients, but that also does not exclude any other lumps and any other problems in the breast which needs attention. So I'm an oncoplastic breast surgeon, means if required, we don't, breast oncology, there are a lot of newer procedures happening in which we are trying to save the breast and treat and do surgery by incorporating local tissues from the surrounding areas and retaining the form of your breast. That is what I am doing, and treating the breast cancer patients.
So I was just mentioning, Dr. Sharma, that, breast cancer is sort of the big thing that a lot of women in particular, when they think of breast and breast health, that's sort of what they focus in on. But there's a lot of other things that are related to, having healthy breasts. So perhaps we could talk about some of those elements this morning. Tell us a little bit about the formation of the breasts, and, what people should be looking for if they notice anything unusual, indentations or marks or anything like that.
Yeah, the most important thing is to be aware of what is your normal breast. Every breast is different. So when you start, maybe when you are a young girl at the age of 13, 14, or whenever you, in your menarche, you should start examining your breast. That will help you in knowing what your normal breast is. And once you know that anything abnormal, you will be able to pick it up on your own. The abnormalities which can happen could be either just a small lump in your breast, or maybe a lump in your armpit, or it could be just a small milky discharge from your nipples, or a bloody discharge from your needles, or it could be just a change in both the sizes of the breast. One breast could be a little bigger than the other, or there could be some itchiness on the skin of your breast, or there could be a dimpling on your skin of your breast. Any change from your normal breast is what you should be reporting to your doctor.
So in order for you to obviously recognize these changes, as you've said, it's very, very important that you get to know your breasts and don't be afraid of them. I feel like as women, we've been sort of, told our entire lives that, oh, just leave the exam for the doctor to do once a year or once every other year, depending on how often you go in for your examinations. But you're saying that, listen, by the time you hit puberty, 13, 14 years old, you're starting to develop breasts. Some children, perhaps even a little bit younger than that, you should start to familiarize yourself with the breast tissue. And that includes everything, the shape of the breasts, touch them, we've seen lots of videos about how to do a proper examination when you're looking for lumps. And it includes not just the primary portion of the breast, but all of the surrounding tissue. And you mentioned, for example, underneath the arms, because that's where some of the lymph nodes and so forth connected to the breast tissue are actually located as well. So some good advice there, folks. It's nothing to be ashamed of or afraid of. It's how you become just acclimated to what's in a very important part of your body. So Emma makes a notation here. She says, "Good morning. How do men examine themselves for breast cancer? I've never heard that explained even to men, as accessible as they are to this type of cancer as well." So we've seen tons of videos, I feel like, as women on how to do an examination of our own breasts. And of course, we're encouraging people to do that on a regular basis, but men also need to be aware. So is the examination touching the breast tissue the same for men as well?
Yes, men can also get breast cancer, but though it's very uncommon. Only about 1% breast cancer happens in men, but that does not mean men should not examine themselves. As I said, it's tender loving care, or TLC, that is touch, look, and care. You have to stand in front of a mirror, look at yourself with your bare chest or your bare breast in front of the mirror, fix a day of the month, and be there in your washroom, look at yourself in the mirror, touch them, and then feel the breasts. Even men who don't have breasts which are big enough, but though there is a small breast tissue, but you should feel it to feel for any nodule next to your nipple, behind your nipple. That is the most important area in men. Behind the nipple, you should feel if there is any mass or any nodule. For the women, if they know how their breasts feel, they would be able to pick up anything which is abnormal. So every day of the month, not every day, once fix up one day in a month to feel and look and care for your breast. That is what I advise everybody.
And you mentioned once a month, but it's also important to try to do it around the same time of the month, because of just changes in the breast throughout the month. So you'll know that, that time of the month, whatever date you pick, you're being consistent with the exam.
Yeah, for menstruating women, it should be usually about 5 to 7 days after you've stopped your periods. For menopausal women, just fix one day. That is all you need to do.
Very interesting. So folks, something new today, TLC, touch, look, and check. So these are the steps that you want to take when it comes to breast health. So the first thing is touch your breast, do an actual examination with your hands to, just feel around the breast and the surrounding breast tissue and the lymph nodes, get underneath the armpits and even, a bit further up to the top. And then in addition to that, you want to look at the breast because, there are changes that might be visible on the skin, such as the skin texture might be changing, it might be puckering or dimpling. And those are things that you definitely want to keep an eye out as well for. And of course, just making sure, as Dr. Sharma said, that you are consistent with your checks. So fix a date. She's given some recommendations on the best time each month to do so. So we do have some prizes that are going to be coming up here in the program. So let's ensure that you guys are paying attention, because we got some trivia questions for you. And this ties in nicely with Tracy's question. So Tracy says, why is it so expensive for mammograms? Many women don't get exams done due to the cost and will only do it if there's if there is in fact something that they're worried about, which in many cases can be deemed too late. It is preventable measure. It's a preventable measure, and anyone over 40 should do this annually. Can we do free screening? So Tracy, you'll be really pleased to know that as part of today's program, you will have the opportunity to actually win a free mammogram. And so there are options, especially in the month of October, Tracy, that offer women the opportunity to get free screening if they cannot afford it. And I think most insurance policies, I stand to be corrected here, but most insurance policies do cover, as part of your routine maintenance, an annual examination in their basic, coverage schemes as well. And of course, if someone needs, this type of care, I know, for example, that the Breast Cancer Foundation has vouchers available at any time that they can also issue to people in the community. So it's not something, Tracy, don't ever let the cost of it or the perceived cost of it be a deterrent for you to get the care that you need. Always prioritize your health, in particular your breast health, which is what we're talking about this morning.
And that's a great segue. Yes, we're going to be giving away prizes on the show today. However, the special that we have, I know that you mentioned in one of the last shows that we're celebrating 8 years. We have our executive health check, which is still happening. That special offer goes through to the end of April. But we also do have our mammogram. Now, for those who check our social media, we have our Live Our Breast Life. I think I sent a flyer over to you digitally, Sandra. Live your breast life. A mammogram takes only minutes. Prioritize your breast screening. So for the month of April, and we have been doing this special, and I know Dr. Rashma's schedule has been filling up with mammogram and consultations, because what we're offering for US $150 is that you will get the mammogram done, you get your results within 48 hours, and then your initial screening and your initial consultation with Dr. Rashmi is also covered within that package. So you do the mammogram, you set the appointment with Dr. Rashmi, and you'll be able to talk with her about the results of it, and as well as provide, as Dr. Rashmi was giving tips earlier on the show in terms of what you should do, you'll be able to ask her directly questions about your results, your situation, and every patient is different, as Dr. Rashmi indicates, right? So you might have a question. There are never any wrong questions in healthcare. So we encourage persons, when they do set this appointment, to, be candid with the doctor. And Dr. Rashmi, I remember when she came, one of the first things she had said to me when I met with her was, she's all about saving the breast, right? So in 2022, years ago, when persons had breast cancer, there were not that many treatments there that would be able to save your life and allow you to live in optimal health. Long are the days when breast cancer is a death sentence. It is no longer so. So have no fear. There are also such advances now where you can have minor surgery to remove lumps, and you don't have to have a mastectomy, right, in order to have a full recovery. And I know that Dr. Rashmi will touch on this later on, but of all the cancers, breast cancer is the one that once you detect it early, there is a significant increase in terms of complete recovery, completely curing that cancer if you catch it early. And so that's why we know that October is Breast Cancer Month, but because Health City has recently, we have our new digital mammogram machine, which is now set up in East End. So we want everyone to know about that. And we also have with our Health City Camana Bay hospital that's coming up. It's currently under construction, as many of you would be aware, and you're kind of waiting with bated breath to see the doors open. We're going to be, the first phase of that is based on oncology, and we're going to be opening up a radiotherapy center there. So a lot of patients would usually, when they have a diagnosis, unfortunately, where there is a lump or something that needs radiotherapy and that kind of care, they would normally have to fly off island to get that, in order to get the treatment that they need for their care and, to live an optimal, healthy life. And so we are very happy at Health City that we're going to be venturing into that area so that we will avoid persons having to go overseas. They'll be able to be comfortable at home, surrounded by their family and friends, and have experts such as Dr. Rashmi to provide treatment to them. Now, one thing that I want to indicate, I always try to let the listening audience know a little bit about the background of the doctor and why Dr. Rashmi is such a great addition to the team at Health City. She is a trained surgical oncologist and oncoplastic breast surgeon. She brings over 20 years of experience in this field. And she has done, from various centers of excellence in both India and in the UK. She has a patient-focused approach to compassionate care with her patients, which helps anyone hearing of a diagnosis of cancer, it becomes an emotional roller coaster ride, right? No one wants to hear that dreaded word. And so Dr. Rashmi, with her level of expertise, her level of experience over the years and dealing with so many different patients, you can be comforted knowing that she'll be there for you. She graduated from the Christian Medical College. She completed her surgical oncology training from the Apex Medical Institute in India, and she obtained her postgraduate degree from Norwich Medical School in the UK. And before joining Health City, she was one of the senior consultants in breast surgical oncology at Dharmanshila Narayana Super Specialty in hospital in India. So NH, the group of hospitals that is our parent company for Health City. And there are two things that I was talking to Dr. Rashmi yesterday, and I said, do you mind if I highlight those two things? And she said, sure. One is she received the gold medal at Pink City Surgeons Society. So what that is, when she was doing her surgical training, which is a number of years ago, I know her experience has been improved significantly since then. But at that time, when she was doing her studies, there were over 20 medical professionals that presented their approaches to breast surgery. And she was the one that won the gold medal at that point. And then there's another award that she has, is the Mary Thomas Memorial Prize for Best Lady Student in Surgery. And that also helped her at that point to decide that she was going to specialize in this area of breast surgery, right? So from an earlier stage, yes, the skills were there, but now with 20 years of experience, bringing that to the Cayman Islands, and we're just so happy to have her. And I hope she's not blushing on the screen, but I feel that it's important that we let your listening audience know that when they come to consult with Dr. Rashmi, it's not, she has such a breadth of experience that you can be comforted knowing that what her advice, her diagnosis, and the skills that she brings to the table is going to be very useful to you.
Very good. And of course, one of our listeners who's also in the medical profession is saying that it's really important for all listeners to be aware that there's obviously different types of breast cancer, and some are much more deadly than others. For example, they mentioned the metastatic breast disease has a 5-year survival rate of less than 30%. So this is why, folks, early detection is your number one defense against any sort of breast cancer. And sometimes a more aggressive treatment is required, but this is where your oncologist has the expert knowledge to be able to explain to you the different types of breast cancer. Obviously, if you're younger, it could be a more aggressive type, and then a more aggressive treatment is definitely required. So thank you to that listener for definitely paying attention to the program and highlighting those significant differences. So Dr. Rashmi, your credentials definitely sound very, very impressive. And we know at this stage that Health City tries to source and bring on the best possible, surgeons and staff. And of course, in your case, it is certainly no exception. So I'm glad that you have a passion for breasts and being a breast surgeon and a surgical oncologist. Now, as a surgical oncologist, how important is it when you see patients? I mean, you might be sort of, the one surgeon that they're looking forward to speaking to the most because of your level of expertise. How important is it to be able to explain to them in just layman terms exactly what their treatment prognosis is going to look like?
Yes. See, over last almost 20 years, treatment of breast cancer has changed tremendously. When I was training, for every breast cancer, the treatment was just do a mastectomy and give them chemotherapy and give them radiation. That is all. But now things have changed. The biology of the tumor is very important. So, some patients need chemotherapy before the surgery, like triple negative breast cancers. We usually, if they are more than 2 centimeters, we're giving them chemotherapy to downstage the disease. And then we are able to conserve the breast by doing something what is called a breast conservation therapy, which a breast conservation therapy includes a surgery, which is usually a lumpectomy with radiation therapy. So now things have changed. And even different types of cancer, some treatment, they require chemotherapy before surgery. Some cancers require surgery followed by chemotherapy. Some require radiation. Some people, we can avoid radiation. So each breast cancer patient is different. And here at Health City, we are approaching it in a very personalized way. Every patient is important. Every patient is different. So we make a plan for the patient in a multidisciplinary team care, which every week we sit together, the team of radiation oncologist, medical oncologist, the surgical oncologist, the radiology expert. So we sit together and we discuss what is best for that patient. And then we go ahead with the treatment. So it is not a blanket treatment for everybody. It is very, very personalized treatment.
Yes. And that is good to know, because I think a lot of us still have that old treatment model sort of ingrained in our head in terms of that's what it is. It's like one stamp fits everyone. So it's so wonderful to hear that the medical profession has advanced really beyond that. Shall we start with one of our trivia questions, Tiffany?
Sure.
Yes.
I didn't think we were going to do the question so quickly, but yes, let's do one, because I think we've been in the Cayman Islands long enough for persons to be able to answer this one. Tell us 2 physical locations from which Health City presently operates in the Cayman Islands. 2 locations.
2 locations, and there's a possibility of 3, but you only have to give 2. So we'll do the question because people might need a minute to kind of think about it a little bit. So let's entertain a few more comments and questions. So Ms. Barbara, good morning. Barbara's joining us. So Chantal says, my male friend got breast cancer and his only symptom was an itchy nipple. Wow. Very interesting. Damien is asking if there's coverage by health insurance and Cineco. So I think we briefly touched on the health insurance coverage. You know, some people are saying that there isn't enough by way of health insurance coverage for routine breast examinations or mammograms. And I think that that is something that hopefully the government is looking at, because I do know that they are looking at sort of expanding and revising some of the health plans that are mandatory at the very bottom level for people to have. And if that's covered, then to me, that makes a lot of good sense. Tracy says that you can do it anytime, every day that you're in the shower. You can make it a daily routine while taking a bath, especially throughout your cycle. It is best to do it 2 weeks into your cycle. So Tracy has become our expert breast examiner this morning. Thank you so much, Tracy. And of course, Tracy has some personal experience. That is why she's so knowledgeable. She says that I've had breast cancer and know what to look for. And you can look up how to do your test and what to look for. So thank you so much again, Tracy, for sharing that very personal experience there. So Soka says, why is it so expensive? Cancer is a $70 billion a year industry. Imagine the money lost if cancer was cured. I know someone who kept being told that they had a little spot there, a little spot here, a little lump there, and yes, good health insurance everywhere. To find out later, they were being treated for cash, not cancer. So sometimes there is this sort of thinking that people are in the medical profession just for making money and not for treating patients. Tiffany, how do you respond to that when I'm sure on your end, you probably get that sort of feedback sometimes from people? How do you respond to that when you hear people saying that?
Yes, and you know, that is the model on which Health City has been built. So Devi Shetty, who is the founder, NH Hospital. He's a well-renowned cardiac surgeon. And the model that Health City uses is actually one that basically transfers all the cost savings that we put in place on the back end of the system to the patients. So if you do a comparison, looking at the services that we offer, if you compare that to reputable health providers, health institutions in the US, for example, you'll see that Health City's costs are significantly lower for the services, the same quality or sometimes even the higher quality of procedures and services that we're able to offer. So we understand that. And so that is why it is part of the mission of Health City Cayman Islands to ensure that we're able to provide world-class healthcare to patients and be able to offer that at an affordable rate. When Health City started 8 years ago now, there was the model of providing healthcare to the local population, but also bringing in persons from international markets who otherwise would not be able to access such quality care at such good rates. And so, just for example, in Canada, there are people on waiting lists for months, years even, to do certain procedures. And there are persons in the region, in the Caribbean, that don't have access to the wealth. Dr. Rashmi indicated the multi-specialties that we offer under one roof at Health City that don't have access to that kind of care. So, we try our best to put that information out so that the public is aware. So if you go on to our website, healthcity.ky, we have that up front and center in terms of the mission, vision of Health City, why we do what we do. And Dr. Devishetti's his mantra was, no one should go away. You know what I mean? A medical solution is not a solution unless it's affordable to everyone. So not wanting to turn anyone away, we've also partnered with charity organizations to be able to provide that high level of care to persons who would have otherwise not have access to it. And so in that same vein, that's why we do certain specials to encourage persons to do their screenings and ensure that we're able to have as many early detections as possible in order to save as many lives as possible. And so this mammogram special going for US dollars, $150, $150, it's really a good value when you think about it, right? Because you're coming in, you're getting your mammogram done, you're getting your results 48 hours after that. You're getting to sit down with Dr. Rashmi. We talked about her expertise to look at your results. And the doctor will also give you tips and tricks. I mean, there's nothing to say you might find something in your results that is completely benign. You could have a cyst. It's not cancer related. And then the doctor might say, well, let's watch it. In another 3 months, you come back to me and let's see, has it gone down? There's several, the doctor will give you the statistics, but there are several cases where persons find something and 3 months it's gone. Or, you know what I mean? It doesn't mean that if you find something on your mammogram, there is anything to worry about. And knowing this, the team actually, the business development team, which is led by Shamari, we have Rebecca, Ben, we have a number of persons that work together on our team. And the medical staff as well has now put together a special email. I know we normally promote, or if you want to have make an appointment with us, to email info@healthcity.ky, but we have created a dedicated email address for breast health. This is the importance that we are assigning to this matter. So if anyone has any questions, or if they would like to set up an appointment to see Dr. Rashmi and do the mammogram, we're asking persons to email breastclinic@healthcity.ky. That's breastclinic@healthcity.ky. And if anybody is driving or not able to take note of that, this information is also readily available on our social media platforms. We post significantly. We actually post daily. So you'll see it when you look at the mammogram promotion, that email address. And we also have a dedicated phone line that persons should call if they're experiencing any breast issues, or they would just like to, have a general checkup. The number is 525-8871. That's 525-8871. And so you can find that readily on our social media pages.
And we also have it at the bottom of the screen for those of you who are watching the program through our social media platforms this morning as well. So we do have quite a few people weighing in on the question. And it seems like the first person that came in with an answer, so good morning to Miss Morna, is Tracy. And Tracy says Cayman Bay and East End.
Perfect.
Ding, 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 ding.
Ding, ding, ding.
Absolutely. Tracy, job well done. And of course, kudos to Evelyn, Tammy, Yvette, Wendy, Tracy, Omeria, Diana, Sherrianne, and others who weighed in and also got all correct answers. But first one to show up on the screen was Tracy. So Tracy, do make sure you message with your best contact number. So Charm says that the insurance doesn't cover mammogram. So this is one area that people continually, are sending information about this morning. So I think this is something of grave concern that perhaps we need to speak to our legislators about, because it seems to me that if you're covering other types of preventatives, like CT scans and other things, MRIs and other things is what I'm hearing, why not a mammogram, which encourages women to take, and men, to take control of their health and to be much more proactive. And, when you were talking about there, Tiffany, that, sometimes you might find something and it might not necessarily be anything of concern, but you definitely want to check it out. Yes. I must say that, in my early 20s, I actually discovered a lump in one of my breasts. Of course, again, you always think the worst case scenario when something like that happens, but it turned out to not be anything of major concern. But because of the size of it, it was actually the size of a golf ball.
Wow.
Because of the size of it, yes, it was very, very alarming. And I was living in the US at the time, and immediately they arranged for me to have surgery to remove it. And then they sent it off to the lab for further analysis, and they determined that it wasn't cancerous in any way. But yes, and I think a lot of younger women can have sort of lumpy breasts, very dense breast tissue. And, those are things that you definitely have to watch for. And it was found by a routine breast examination, actually by my physician, who was just doing a manual exam. So yeah, folks, those manual exams are really, really important. And I have had a sibling who has had breast cancer. And of course, anytime you have any sibling or parent that has had breast cancer, you definitely want to be on the lookout as well.
Yes, definitely. And the doctor will indicate that if you do have a family history, you definitely want to ensure that you pay attention and get those checks regularly.
Yes.
Dr. Rashmi, do you?
It's important to remember that not all breast lumps are cancerous. Only 1 out of 8 to 10 are cancerous. So you needn't be scared that because you have a lump, it will be cancer. Most likely it will be a benign lump. It could be a fibroadenoma. It could be a cyst. Yes. The most important is to just go to the doctor, get yourself checked. Even an abnormal mammogram doesn't mean you are going to have cancer. Only 10% of the abnormal mammograms will need a biopsy. And only 10% of those biopsies may turn out to be positive. So even if you have an abnormal mammogram, you are called to see a doctor, don't be scared. Just go and see them. They may be able to tell you that you just need a follow-up after 6 months or after a year. So the important thing is to get yourself checked and see a doctor. Let the doctor decide what you have. Most likely it may be a benign disease. Even if it is cancer, it will be picked up in an early stage where it may be curative.
And then to add to what Dr. Rashmi said, that yes, there's a small chance that it could be. But if you do fall into that category, that 1%, that we do find something, I think what I'd like to drive home this morning to your listening audience is that we have doctors like Dr. Rashmi, who is the only breast surgeon, oncoplastic breast surgeon in the Cayman Islands. We have that expertise right here at home. So you need not worry, right? And with her years of experience, as I indicated, and also with her philosophy of saving the breast, her first step is not going to be recommending mastectomy or removal of your breast. I know that in Dr. Rashmi's practice, because she said it several times with us internally, is looking at all the modalities that we can implement in order to save the breast. Minimally invasive, doing biopsies, doing the removal of the lump rather than the actual breast itself, so that it's a very this is an intimate area for a woman, right? Wanting to preserve that area of the body for more than one reason. And it's Mother's Day coming up. That is such a integral to the whole pregnancy and bringing a baby into the world. So, and this is why Health City, we decided to extend this promotion through to Mother's Day, which is May 9th. And reminder to anyone out there who doesn't remember, Mother's Day is coming up, to treat your mothers, grandmothers, wives, and so on. Ensure that they know how special they are. But at the same time, if you want to gift them something, or gift yourself something for Mother's Day, that you take advantage of this special promotion and get yourself checked out, then that would be good as well.
Absolutely. Well, thank you for that reminder. And yes, folks, Mother's Day is coming up quickly, right around the corner. So start making your plans in relation to that. So again, folks, Health City is here for their medical rundown Tuesdays, and they have a number of specials on, but the one that we're highlighting today is for your mammogram and consultation with Dr. Sharma, only $150, which is a steal. Because if you have ever, booked one of these before, you'll know that the cost is normally 4 or 5 times that. So that's US dollars, by the way.
Yes.
So take advantage, folks, of this mammogram and initial follow-up consultation with surgical oncologist and oncoplastic breast surgeon, Dr. Rashmi Sharma. Now, some people are saying that the 48-hour turnaround time, that they've not received their results in that amount of time. Is that a realistic time frame, or is it going to be longer, really, because of the number of bookings that she's getting?
Well, I know Dr. Rashmi shared with me yesterday that she had 12 appointments in a short space of time on Wednesday. I'm kind of wondering whether or not it's a good thing for us that we're seeing an uptake. As we said, this promotion is geared around Dr. Rashmi, and obviously she's our only breast surgeon in the Cayman Islands and in our Health City facility. So for us, from a marketing perspective, it's great that people are taking their health into their own hands in order to get this done. I know our team in the background tries our best to ensure that we can get those results out as quickly as possible. I think if it comes down, if we do have more people that take the promotion than we initially thought, we might need to expand it a little bit more in order to manage the volume. But I think, thank you for the listening audience for giving that feedback. When I go back to the office, we can actually look into that to see if there's a backlog in any area and try to address that as best as possible. Because we don't want to discourage anyone from taking advantage of this special offer. Yes, we're sure that Dr. Rashmi is up to the challenge of doing additional consultations if we have more uptake, which is great. But we do want persons to get their mammograms done, knowing full well that we'll be able to do that initial follow-up with Dr. Rashmi within a reasonable amount of time.
All right, very good. Well, thank you so much for that feedback. So let's just see if we have any other comments that are coming in. So we have Soka says, I think I read that mammograms are not as widely recommended nowadays as they previously were. So are there different types of whether it's a mammogram, an ultrasound, there are different types of devices that are used to diagnose breast cancers or the breast health, and which one is still the best option available to women and why?
Mammogram is still the best option. It still is something which picks up cancer at a very early stage. So I would still recommend you to get a mammogram. Only in younger women, I would say mammogram may not be so sensitive, especially less than 40 years of age. In those cases, we usually advise an ultrasound plus a clinical examination. Sometimes a mammogram may miss a cancer, but you should always see a doctor with a mammogram or without a mammogram. Sometimes we may need some additional tests like an ultrasound of your breast or maybe even an MRI. But mammogram is still the best investigation available to pick up a very early cancer. So don't ever say that mammogram is not required. Mammogram, especially above 40 years of age, it is quite sensitive.
And what is the current recommendation for how often a woman should be getting a mammogram, and really at what age?
Yes, according to the American guidelines, between the age of 40 and 44, women is given the option to get a mammogram. She can opt for it or she can opt out of it. But after 45 years of age, up till age 55, we usually advise, according to the American guidelines, a mammogram every year. After the age of 45, if you've already had a mammogram, usually you can go for every 2-yearly mammogram. You don't need a mammogram every year. So a mammogram every 2 years after the age of 55 up to the age of 75, or up to the age where you have a life expectancy around 10 years of age. So what is advised is 45 to 55 every year. Less than 45, you can get a mammogram, or you can opt out of it also. But after 55, every 2 years, you should get a mammogram.
And so Maria,
one more thing I need to add: if you have a family history of breast cancer, or if you have a family history of ovarian cancer, consult your doctor. You may need a mammogram even earlier than 40 years of age. Sometimes we need it even at the age of 30 years if there is a family history, or if there's a history of BRCA1 and BRCA2 positivity, or ovarian cancer, or even a radiation history of radiation to the chest for following a lymphoma or something. Then we may assess your risk according to some risk guidelines, and then advise individually what you may need.
Okay, very good. So Maria says, can you inquire if women over 70 should still get a mammogram? Because she was informed recently that this test was not necessary if you're over 70.
If the thing is, if you are in good health, and if you have a life expectancy of more than 10 years, at 70, you should get a mammogram. Only if you are bedridden, or if you have other comorbid conditions which prevents you from going for a mammogram, then I wouldn't force you to get it done. But if you are in good health, why not?
All right, good. So Maria, hopefully that's useful information for you. I was sort of thinking about that as Maria said that, because, I've got a mother who's like in her 80s, and she recently had a bout of breast cancer, which was treated with surgery. And, she's on the path to recovery now for several years. So, I think that as long as you're able to, as the good doctor said, go to the appointments and get the mammogram done, there should be nothing really that stops you from doing it at any age, especially as you get older.
Yes, because age is one factor which increases your risk. As you grow older, your risk of getting breast cancer does increase. So life expectancy, if you are expecting a woman to be there for at least 10 more years, then you should get it done, so that if there is anything, you'll pick it up.
Yeah. Soka shares some thoughts about Health City. She says, sadly, very few doctors have Dr. Shetty's heart. When I first heard about Health City coming to Cayman, I Googled Dr. Shetty and could not find one blemish on his record. In fact, I seek our advice from Indian doctors and pharmacists in the US before any other. Seek out, I think is that supposed to be. An Indian doctor kept my son out of the hospital with asthma. When an American doctor was over medicating him, he told me to take him home and give him hot tea or hot coffee anytime he was having an attack. And 20 years later, never. And then unfortunately, Soka, that got cut off. But sounds like the recommendations of the physician there was a very, very useful to her in that situation. Thank you so much. Marshall says, I've known of a young woman who was diagnosed with breast cancer at the age of 35, and she has since died. So I think it's important to clarify that a woman can certainly get breast cancer at any age. I mean, we've had people here in the Cayman Islands in their early 20s who were diagnosed with breast cancer. And unfortunately, I think the younger you are, normally the more aggressive the breast cancer is. And, the prognosis is probably not going to be particularly good in those cases.
Yes, that is true. The younger patients can get breast cancer. That is why we advise that all women, all women should examine their breasts, go to the doctor once they detect anything. Even younger women, we advise that they should get an ultrasound of the breast to pick up anything which they are not able to pick it up. Sometimes even a mammogram is done, because if we find anything abnormal, we do a mammogram. But mammogram may not be a very sensitive test. Then we may advise additional tests like an ultrasound or maybe even an MRI to pick up any abnormalities. No age is exempt, no sex is exempt from breast cancer. Even males are getting it, younger patients are getting it. The only important thing is to be aware about your breast and report to the doctor once you find something abnormal. And yes, younger patients do have a little aggressive form of breast cancer, which is usually called a triple negative breast cancer, and it requires very aggressive therapy. Sometimes we have to give chemotherapy before the surgery to deal with the breast cancer. But with the recent advancements in greater availability of newer therapies available for breast cancer, we are able to take care of that also. But I cannot say that younger patients should not get any tests done. They should definitely come to a doctor and maybe get an ultrasound done.
Ms. Donna says that her niece died from breast cancer at the age of 33. So again, just a reminder that this is something that can still be deadly, and even deadly to some younger individuals as well. Now, I wanted to speak a little bit about some of the contributing factors. We know that cancers, some cancers have been, linked to lifestyle sort of, habits, if you will, and others not so much so. But breast cancer does seem to have certain links to your hormones and activity and weight and so on. So what are some of the things that we can do when it comes to being in optimal health to really try to focus on reducing our chances of not just breast cancer, I'm sure, but all cancers? But let's just focus on breast cancer specifically.
Yeah. To this, I would answer remember the 5 points. First is you get moving. Don't be sitting at one place. You should start exercising. What I advise my patients is 2.5 hours of exercise every week. That means 30 minutes every day, brisk walk. That decreases your breast cancer risk by 30%. So get moving, exercise. Second is maintain a healthy weight. If your weight is healthy, if your BMI is less than 25, you have a better chance of leading a normal life. So eat healthy. Now, what do you eat? You should avoid processed foods. Eat more of vegetables and fruits, less of red meat. See that you have at least 5 servings of fruits and vegetables per day so that you maintain a good weight. Then comes to smoking and alcohol. Smoking does increase your chance of breast cancer. Why? Because it causes genetic mutations. So if you are smoking, just make it a point and make up your mind to quit smoking over some time. Coming to alcohol is another factor which does increase your risk of breast cancer. So try to decrease your alcohol intake. If you take 3 drinks per week, your chances of breast cancer increases by 15%. So you should try to decrease your intake of alcohol. These are the 4 points. Fifth is getting a mammogram. If you get a mammogram and if you have to have something, you will be able to, the doctor will be able to pick it up early and give you a treatment which is required. So 5 things you must remember: eat healthy, exercise, try to stop smoking, try to quit alcohol and smoking, and if you are at the right age, get a mammogram. If you are younger than 40, just go to a doctor. Maybe you need an ultrasound of your breast.
Mm-hmm. All right, folks. So some good tips there. Shall we move on, Tiffany, to trivia question number 2?
Yeah, so this one should be really easy for if persons have been listening all morning to our guest in the studio. Who is the only breast oncology surgeon currently residing in the Cayman Islands?
Super easy. They've just
easy.
They've just got to have been paying a little bit of
attention
this morning. And I'm not going to repeat the answer right now. I'm sure people are like, say it one more time, Sandy. All right. Let's see who is weighing in first this morning. Tracy says Dr. Shetty. Yvette says Dr. Rejma. Close, Yvette. Just a little bit off on the spelling.
We could give her that.
We'll give it to her.
Yeah, it's just a spelling. We won't penalize her for spelling.
Rashmi, Rashmi. But all right, Yvette, we're going to give it to you. We're not going to be like Soka. Soka would have penalized you for misspelling it. So Tracy says cancer doesn't care about age. Also, please mention that when doing a self-exam to not just check the breast, but also under the armpit, which we did mention earlier as well. The surrounding tissue is extremely important. And lumps under the armpits can mean lymphoma cancer. So thanks, Tracy, for that reminder. Miss Beulah says that one of her sisters actually got breast cancer at the age of 26, and she changed her diet right away, and she's now in her 50s and cancer-free. Wonderful.
That's wonderful.
Yes, very good.
Soka and Marshall came in a little bit late with those answers, but yes, the correct answer is our guest who's on today, Dr. Rajmi Sharma. So again, folks, the only person on island with her level of expertise. So Yvette says, thank you. I called the number given. All right. So Yvette, just WhatsApp us your contact details and we'll ensure that we pass that along to Tiffany and the rest of the team over at Health City, and they'll get you sorted out with your appointment. So the WhatsApp number, you can send it to the same number that you can call into the program, 936-BOBO. That's 936, folks, 2626. Thank you very, very much. So wonderful. All right. So we do have one more question left. So if you've been itching to win this free mammogram and consultation with Dr. Rajmi Sharma, get ready now because
drum roll.
Yes.
What email address has Health City recently set up to accept queries related to breast health? That one should be very, very easy if you look on your screen.
I know. I was just going to say, if they're paying attention, they should really need to get this one for sure.
We want to make it as easy as possible for persons to get their checks done.
Yes, absolutely. All right, folks. So what is the email address that has been set up to accept queries related to breast health? It's a Health City email address. Let's just see. Marshall says breasthelp.com. No. Oh my gosh, Marshall. Iva says I was 30 while I was 37 when I was told that I had stage 3 cancer, and cancer has no respect for age. So thank you guys so much for just reminding people of, your own experiences, sharing your own experiences, and reminding people of the importance of checks at any age, really. Emma has come in with the correct answer. Yes. It is breast clinic at healthcity.ky. And again, for those of you on social media, if you were looking at the screen, you would see it right there. Phone number and the email address. So yes, Emma, congratulations. Send us a little reminder on WhatsApp of your contact details. Jermaine was in with the correct answer, but a little bit, probably a second behind Emma. And so Emma got it at Charm. Good effort there. So again, folks, that's 3 breast exams and mammograms and consultations with Dr. Rajmi Sharma that have been given out this morning, courtesy of Health City here on Medical Rundown Tuesdays. You can find them here every single Tuesday at the top of the show to discuss all, anything related to health and wellness. And we're so excited to have them be our exclusive partner here on Cayman Mall Road for all of your medical wellness. And this is fantastic. So any final thoughts, Tiffany, from you, and then Dr. Rajmi from you as well?
Yeah, I just want to thank publicly Dr. Rashmi for coming on air this morning to share with the listening audience her expertise, her tips and tricks in terms of, knowing your health. And I want to encourage everyone listening that especially if you do have a family history, and even if you don't, and you just want to get yourself checked out, maybe it's the first time you've never done a mammogram before and you've been thinking about it, this is the time to do it because there's a special offer in place. You're not going to get it done any cheaper at any other time. So we encourage you to take advantage of the offer at this time to get get everything checked out and have that consultation, that initial consultation with Dr. Rashmi.
Wonderful. And let me just chime in here. $150 US, folks, is an absolute steal. I know some of you sit down and have drinks on a Friday night that your happy hour bill is more than $150 US.
Yes.
So prioritize your health. Some of you are even saying a normal price of $400 is a lot of money, but I know some of you that will pick up an outfit for more than $400. So folks, you get to decide. We get that the cost of everything is definitely going up, but you get to decide how you're going to spend your money. And I think prioritizing it on your health and well-being is definitely the way to go because you can't put a price on good health. Dr. Rajmi?
Yes. Yeah, I would like to add that all women should gift themselves a mammogram, either somebody gifting you or why not gift yourself? And the most important is early breast cancer is curative and not all breast lumps are cancer. So even if you have a breast lump, at least come and see us. It may not be cancer.
Mm-hmm.
It may just be something benign. So it will relieve you of all the anxiety and the fear.
Right. Absolutely.
Yeah.
Okay. Well, thank you, ladies, so much for joining the program this morning. Tiffany, good to see you here. This is your first time on the Medical Rundown Tuesday segment. I appreciate having you.
Thank you it was a great show today.
Yes, absolutely. And Dr. Rajmi, thank you. I'm sure that we will see you again in the coming months.
Yeah. Thank you so much for having me.
Thank you.
All right, folks. So that's our guests there at Health City. So just a reminder that they're continuing to expand their services. They're now in Cayman Bay. So after this brief message, we're going to kick off our open topic segment. And of course, we're going to be talking about the unfortunate fatality that occurred last night, as well as updating you guys on a few other things. The show goes on until 9:30, so make sure you message your friends and tell them, tune in right now. Sandy's still not done, and we're going to be talking about some hard-hitting topics here in just a second.
For over 7 years, Health City Cayman Islands has provided life-changing and life-saving medical care for the people of the Cayman Islands at our hospital in East End. During this time, we have become an integral part of the community. And now, focused on connectivity and collaboration, our vision is to make an even greater impact on the quality of healthcare for the people of our islands. In summer 2022, we will open a 70,000 square foot state-of-the-art hospital built on 3 acres of land at the southern end of Camana Bay, bringing much-needed specialized medical services closer to where people live, work, and play. Camana Bay, located at the heart of 7 Mile Beach, is home to schools, businesses, shops, restaurants, and entertainment. And now, Health City Camana Bay, a $100 million world-class hospital. Health City Camana Bay will include an advanced cancer care unit offering bone marrow transplantation and the latest cancer treatment technology. It will contain a modern neonatal intensive care unit, emergency and critical care, purpose-designed operating rooms for surgical specialties such as cardiology, neurology, and orthopedics, and robotic operating systems. A master plan for improved health care for the people of the Cayman Islands. Ready to meet the needs of our patients here and now, we have already established a footprint in Camana Bay with the opening of our clinic. Offering short wait times, extended opening hours, including evenings and weekends, and the ability to see our world-class doctors closer to where our patients live and work. The clinic has bright, comfortable waiting areas and treatment rooms, friendly staff, expert care, lab services, and diagnostics. Reflecting our operating philosophy of patient-centered care, convenient access to our specialist doctors allows our patients to focus on getting better rather than getting to appointments. With our unwavering commitment to our community and the thousands of patients who trust us to care for them, we look forward to building healthier communities in a place where life unfolds, blossoms, and thrives. Welcome to Health City Camana Bay.
All right, folks, welcome back to the Cold Hard Truth here on Bobo 89.1 FM, YouTube, and our Facebook listeners are also tuned in. We've been holding steady with over 200 streamers, or I should say listeners, on our streaming platforms this morning. And unfortunately, we have to talk about, some really, really sad news and sort of the surrounding information that we have available on this right now. So last night, a gentleman lost his life, retired prison officer, no less, simply by walking into an establishment where a robbery was taking place, and he was collateral damage. So I understand that some sort of altercation or scuffle ensued afterwards, and he was shot in the head of all things, folks. I mean, this is so horrific. When we first got the initial alert that this has happened, I must tell you that I paused for a moment and I thought to myself, is this a joke? I mean, is this really the Cayman Islands? Because I was so shocked by the news that someone has been killed in such a graphic manner. And then I had to take a minute and think about this. And this is not the first time that someone has died in very, very similar circumstances. So at around 8:44, the alert went out that there was a critical incident at 190 School Road, gunshot with one male who was shot and bleeding from the head, unconscious and not breathing. Both police and EMS were on the scene. And we are really, really saddened to say this morning that we have the identity of the individual. Well, we had it almost immediately last night, but we were not minded to share it with a broader audience. But of course, we are aware, that people knew who it was, and people were messaging us sort of privately about this incident. So Mr. Harry Elliott, who is a former prison officer, has succumbed to his injuries last night. The injuries were pretty much immediately fatal. And we wish to, first of all, extend our condolences to Mr. Harry's entire family. Everyone, has expressed that he was such a kind and gentle person. And they were very, very shocked and saddened to hear of the manner in which he passed away. But, here in the Cold Hard Truth, folks, we have got to discuss some of the surrounding issues with this, because this is one of those situations where, unfortunately, his habit or his propensity or desire to gamble in this instance really put him in harm's way. And, I'm going to take a really hard line on gambling. I know a lot of people in this community do it. I've had family members who do it all the time. They're into buying numbers. And we've seen where, buying numbers, which remains an illegal activity here in the Cayman Islands, it is completely illegal to gamble here in the Cayman Islands, has really set up a sort of parallel criminal enterprise that I don't know if a lot of people are simply not paying attention or they're not aware of this, but this is the second fatal incident that I can think of, and there's probably more, involving an individual being robbed because people knew, the criminals know that this person is a numbers man. And so that we need to talk about this. There's no sugarcoating this. There's no way around this, that if you are a numbers person, you are taking your own life and placing it in the hands of criminals because they know who you are. Everybody knows who you are except the police, it seems, because they're not making enough arrests of number selling and numbers individuals. And I don't know why that is. But the police, I think, need to take a very hard line against illegal gambling. And I'll tell you why, because had it not been for illegal gambling, poor Mr. Harry would have been alive this morning. The truth is, criminals know who the numbers people are. They also know that because their activity is completely illegal, a lot of the numbers people can't just jump up and go and put, $10,000 a day plus in the bank and secure it. So they're easy pickings for people who are robbing, because guess what? You've got cash in you, you've got large sums of cash, and you're involved in illegal activity. So normally when you get robbed and you're involved in legal activity yourself, your first instinct isn't probably going to be to run to the police, because the police are going to be like, oh, you got robbed of what? $25,000. Well, why would you have $25,000 cash in you? The police are going to start asking you questions. And of course, I think a lot of number sellers are aware that what they're doing is completely illegal. And so, you put yourself at immense risk getting involved in this business. And man, let me tell you something. Like I said, I don't buy numbers in Cayman. I was in Florida recently and I bought my traditional lotto ticket. The lottery was up to, I think it was $30 million for the regular lottery. And then the Powerball was $400 million. I always joke about it and say, oh yeah, this time I'm going to win. I spend $5. I'm not really a gambler, but I know some people who are very addictive with gambling. And it's almost like they cannot help themselves. The second they get $1, they run and go spend that dollar and gambling. Some people spend all $150, $200 a day buying numbers. And this is a really, really serious indictment on us as a people, because clearly we have people with some addictions here that we are not addressing. And in fact, the most interesting thing about it, folks, is people can tell you any time of day, oh, this just played in Honduras and Jamaica. And I mean, they play numbers from all over Timbuktu. The other day I was visiting an elderly lady. And I said to her, oh my gosh, you're 80, whatever, 85, 84, whatever. And she said, yeah, the first thing was she said to me, well, Sandy, that number played in Jamaica numbers, though. I should have bought it. I bought Honduras. I was just like, okay. This is a problem, folks. And the criminals are sitting back there going, which one of these numbers people can we pick off next? Remember the last guy, and correct me if I'm wrong, but the last one to have gotten murdered, again, was in West Bay, that apartment complex right before the Domino's, right? Upstairs there, he was going home. They, again, know he sells numbers, and they went and robbed him. And I'm not saying that these criminals, which we're going to talk about them here in a second, I'm not saying that they're necessarily going out there thinking, oh, I'm going to kill someone. But in the commission of their robbery, if somebody gets shot in the head, it's just collateral damage. And whoever these people are, there's 2 men involved in this incident last night. I don't know how you slept last night, but I hope to God that you never have another peaceful night's rest ever again. And you need to get up and you need to go to the police. There's 2 of you. So maybe one of you don't have a conscience, but the other one does. You need to get up and go to the police and confess what you have done and just plead guilty and go sit your behind in jail, because now we're going to have to feed you for a quote unquote life sentence, right? Which is going to be 25 to 30 years of your life. But you took an innocent man's life. Yes, he was gambling, and gambling is illegal, but that does not warrant you shooting a man in the head and taking him away from his wife of how many years, from his family. And I'm sure he's got grandchildren and children and, brothers and all this kind of stuff. It's an absolutely horrific way to have a person's life end. Someone who should have been enjoying his retirement years. So my understanding is that his wife actually worked at a gas station in the area, and a lot of times he would go and pick her up from work, or would go there to see her, and just walk across the street and go over to the numbers guy and to buy numbers. So it seems that in all likelihood, this is exactly what happened last night. And then the robbers come in, quite unfortunately, at the same time to rob the numbers guy, and a scuffle ensued, and poor Mr. Harry got shot in the head, and he's now dead. Absolutely horrific. I mean, I'm so sorry for his family to have to be going through this. But once again, if you're in the number selling business, this is part of the risk that you are taking. And for what? Who's gaining from number selling? It's not normally the people who are playing, because trust me, if they calculated how much money they lose on buying numbers versus how much they win, they will see that it's a gambler's game that they are not going to win, right? And there's a lot of money in this. I mean, I have heard from very well placed police sources, some people pulling in millions of dollars on an annual basis with illegal gambling. Millions of dollars, the kind of money that those of you who are supporting them and buying numbers will never see in your lifetime. So, there's enough blame to be had with this issue. Someone was saying to me this morning, they're blaming the politicians. I'm like, the politicians are the ones going out buying the numbers? How does this, politicians are not even the ones who can put pressure on the police. Now, if people can come to me and give me some of the high ranking numbers, people in Cayman, the names of these individuals and who they are and what they're doing, they got brothers hiding their money. They got the mama putting money and buying property in their name. You people know who you are. And apparently, sometimes the police know who you are as well. And they just keep going for the low hanging fruit. So every time they have a little bus that, what is that one? There on, what is that road called? Is that Smith Road? Right across from Funky Tangs and down in the east, but it's the one across the way there, that bar. They're always raiding over there. I don't even know what the bar is called, but they're always raiding over there for numbers and gambling and all sorts of illegal activity, right? One observation I make about gamblers is they seem to have a lot of time on their hands. So, they don't even they don't even have real jobs, apparently. They're just spending all their time gambling. And it's so interesting because a lot of times it's not just buying of numbers, it's cards gambling and all this other stuff. It really leads to some of the most unsavory individuals hanging around your property. And some of them are just hanging around to see how they can set you up or how they can rob you or steal from you. So someone just said that 30 is going to play for 10:30 this morning, and they said that they're just joking. Well, the thing about this is it's not just a joke. It is a very, very serious indictment, I think, on us as a people. No, it's not that one. Someone is sending me another one on Smith Road. No, this is what's the name of this bar? Y'all help me out here. Archie's. Thank you, Damien. Yes. Magdalene and Damien got it. Yes, Archie's is a known spot for gambling. Why do they still have a license? Now, I don't know who owns Archie's, and quite frankly, I don't care. But if you are a license holder, you have a liquor license, and you know that your property is being used for gambling, and you don't clean that up, because you have a responsibility as a business owner to ensure that illegal activity is not happening on your grounds. And if you have not cleaned that up, folks, at some point, the liquor licensing board needs to say, hold on a second. CBC has raided you how many times and how many years? The police have raided you how many times and how many years? And the individuals are being held to account. Yes, and that is right. They should be. But the business premise that is allowing this type of behavior to go on should also be held to account. And at some point, somebody need to pull these business licenses. Stop playing with these people. Take a more proactive approach. So when I Google Archie's on Facebook, I can tell you that over the years, there have been, oh my God, so many raids there. I have literally lost count, right? Dating back to probably 2018 or 2019. Here's one, November 28th, 2019. Archie's Bar and Restaurant reopened early this month with a temporary liquor license after a 6-week closure due to various infractions. That was 2019. Seems to me that the infractions continue, but they're not shutting them down. Okay, so that was November 28th, 2019. We had October the 6th, 2019. Archie's Bar and Restaurant shut down after numerous raids. August the 19th, 2019, task force in full swing at Archie's again. Let me show you guys these screens for those of you who are watching online, because you might not believe me. You might be like, what is Sandy talking about? I don't remember any of that stuff. Well, here it is. A quick search for Archie. Now you have to forgive me for all the other ones, but there's lots of Archie related raids here. So let's see how far back we can go. So we have, we have May the 31st, 2019, Archie's Bar raided. So there's task force there that day. We have June the 3rd, 2019, police confirm Friday's raid by Archie's Bar, 4 persons arrested. And what are they being arrested for? Look here, same thing over and over again. Illegal gambling, suspicion and possession of ganja. August 19th, 2019. October the 6th, 2019, Archie's again. Like, how many times does one establishment have to be raided? And not just 2019, right? We could change the filter to some other years. But my question is, how many times does an establishment have to be raided before we go, yeah, Houston, we clearly got a problem here, right? This is just one example. And again, I'm not picking on Archie's. I'm just saying, look at this, July 25th, 2018, Archie's Bar being raided by Immigration, Customs, and RCIPS Task Force. Archie's again, July 27th. Look at the headline, Archie's again, July 27, 2018. May the 25th, 2018, Archie's Bar being raided for illegal activity, including drugs, gambling, illegal immigrants, and prostitution. So that was May of 2018. May the 25th of 2018, being raided in broad daylight again. So honestly, those are the 2018 ones. Let's see if we only started in 2017. So I don't know if we have any for 2017. Oh yes, that was a little fire in December 2017. So 2017 was only 6 months. So they didn't have too much going on there then. But folks, the point is, this is a known activity all over the Cayman Islands. There are some hot spots that we are aware of and that obviously the authorities are aware of. And I think that it's high time that they start holding the businesses responsible for this. Now, on Eastern Avenue, this is what my sources tell me. And like I said, I'm not in the gambling business, so I don't go there buying numbers. But apparently there are several facilities, mostly barber shops, that people will go to, and they will purchase these illegal numbers. Now, I don't know how many barbershops are in Eastern Avenue. Eastern Avenue is probably only 2 miles long, if that, right? But I know there's quite a few barbershops in there. And at least 1 or 2 of them have a reputation for selling illegal numbers. Now, if I know this, and I don't go to barbershops, first of all, I don't really visit very many places on Eastern Avenue. And on top of it, I don't even buy numbers. But if I know all of that, how is it that the police don't know who these people are? It can't be that they don't know. They must know. So Jonathan's solution is to legalize a local lottery. But is that really a solution? I'm going to tell you why I question this, Jonathan, because the illegal aspect of gambling, right? Even if the government had their own government lotto, like what they do in Florida, whatever, you will always find people being drawn to illegal gambling for a variety of different reasons. Legal gambling has controls in place, right? In terms of how the numbers are sold, how they're selected, and how you play, et cetera, et cetera. If they set up a legal gambling house here in the Cayman Islands, it's not going to be based off of buying numbers in another country. That's not how it's going to work. You'll find that a lot of individuals are not necessarily going to take to legal buying of numbers if that was made available through some sort of government set up scheme. There are a lot of people who suffer from a gambling addiction. Some politicians too. Child, they listen. But at least they tend to wait until when they go overseas and then they hit the casinos hard. But we know that they got a problem. And they spend, if they go away for a weekend, they spend an exorbitant amount of time in these casinos and they spend an exorbitant amount of money. But hey, in the US, it's legal. And at those facilities where they have a lot of cash, people are there gambling, you better believe that they're going to have some degree of security in place with armed guards so that they're not going to be targeted as easily. But you know what? It happens even in the United States of America. Remember that Caymanian who went to the casino and got robbed of his Rolex watch and some money? Yeah, remember that a couple years ago? There have been instances of people going there and getting drugged. So people can take advantage of them. And a lot of times the women are in on it and setting up these men to part them with their luxury goods or their hard-earned cash. Ms. Morna, thank you so much. She says, love the color of your lipstick. Thank you. Mr. Hoyt Phillips says, police set up all the number of people to get robbed for a cut of it. So, I mean, I don't know that that's what's happening. There's no evidence to that. And if that has ever happened, I would certainly hope that those police officers are found out and they're weeded out. But the police don't have to set anybody up because everybody in Cayman knows who sells numbers. Hello. It's, they walk around with their books. Right now, if I want to buy numbers, I could make one phone call and be like, okay, I live in Savannah or I live in East End, I live in West Bay. Who's the closest number seller? There's a couple of them in Prospect, by the way. Again, everybody knows where they live and how to find them. So it's not like you need the police to assist in that. And what you find is a lot of these people also dabble in other illegal activities. So it's not just the gambling, but a lot of them are dealing with drugs. They're laundering the money and all of these other things. And it's a recipe for a disastrous situation. So someone says, yes, the police themselves are buying numbers. And big name from last night was so-and-so. This is the guy that they went to do the robbery. See, everybody knows. This is the worst kept secret in the Cayman Islands. He operated the old tailor shop across the street from the restaurant on Schoolhouse Road. So if everybody knows who this man is and that he is in the business of, selling numbers, police, RCIPS, where are you? Who's falling asleep at the job? We got a caller who wants to weigh in on this. Good morning, caller, and welcome to the program.
Good morning, Sandra. Good morning, Guada Cayman also,
Yes, good morning, sir.
Yeah, I want to talk about this gambling thing still a little bit, Okay, well, first of all, I want to say I don't gamble. I already gambled with life. So I can't gamble once since I have in my pocket. Okay, but with gambling, I think the Cayman Islands government come on board because I think there's a lot of money leaving here and a lot of opportunity for us to make a new revenue, and start depending on the permits and certain other stuff that we depend on. And I believe that this could fix a lot of stuff in our infrastructure if we get it right. And I do allude to, which I don't think is correct, if we had a national lottery here, I think that would be played more than anything else because of the dollar value. That's very high, and I guess it's also going to be tax-free, if I can say that. Yeah, so I think that would do a lot of help. But there is negative notations around gambling, as in almost every other industry. But gambling, yes, it does carry some bad characters with it. But if the government get it right, I think that would be a great revenue for the Cayman Islands and people here.
So you think if we legalize gambling, that will, the issues that surround gambling will disappear?
No, but if we legalize it, we're going to put certain stipulations in place to get it more safer, I guess.
Yeah, but do you think
But
illegal gambling disappears just because you legalize it?
no, it never. Gaming will never disappear illegally or legally.
Right.
It would never disappear. Humans have made a chance. So why not make something off of it? Okay, we are saying almost $400 million leaving the jurisdiction through repatriations or through Western Union, and money transfer and stuff, right? That's leaving the Cayman Islands. That's not doing anything for our infrastructure.
Right.
So if most of this money is leaving because gambling wasn't into it, and gambling is one of the biggest revenues that I see generate here. That is illegal that nobody really talks about, but it's a big earner because I know guys who win $100,000 for the Sunday off of one number, and times that by how much people might play. So I think that's a lot of money that's leaving our jurisdiction that could be used here also to do some different infrastructure, the schools, the old people, something. But it's not being done. So if it's already here and it's already in our eyes and it's already beating the police, and the police, even as you alluded to, the police have joined it because I know of officers who buy numbers also. You know what I mean? Which is not right in no way, but everybody wants a chance. I know guys who have been broke, and because of one little number, and they were all right to feed their family and pay their rent for the month. So it does help, and it does take away. It adds and it takes away at the same time. So it's just, we have to put it in a place where we can maintain and monitor it. So we could say what happens with it. So if we had a national lottery or something, I'm sure it's going to put certain stipulations in place as securities that it won't go rogue. Nobody won't be running into robbery. Just like the lottery, when you win the lottery, nobody is running robbing the person who won it, who won the millions, because they're protected.
Well, sometimes they get robbed, but that's why, when you win it from the government, they will send you your deposit online. They're not going to be handing you a bag of cash, or nobody walks around cash, right? Yeah,
that's a setup. If I went to the bank and I needed $1 million, I came out there with cash, that'd be stupid. I'm asking to be robbed. Exactly. If I came in there with a cashier's check, that's something different. Nobody knows what I have. But as I say, I think it's a good thing for the island if we do introduce it as a legal entity, because it will help a lot of stuff, and it will create jobs, and it will stop this under the carpet thing where everybody is doing it, but nobody's supposed to be doing it. It's illegal, but it's really legal. As you said, everybody knows the ones who are selling the numbers and playing the numbers from back in the 80s. But we allow it to happen, and we allow this revenue to escape us year after year. So I think it's time the government put their foot on the back of the snake's neck. Say, let's take this over, or let's kill it all together. It's either, but you can't have this this illusion that it's illegal, but the government plays it also. It can't work. You can't be oxymoronic in it. It's either bad all the way, or it's good. So we have to do something about it. So might as well they put their hands in it to get some money out of it, make a next pillar of the economy. Thank you. Have a good day.
Thank you, my dear. Appreciate it. All right, folks, 936-2626 is the number. Weigh in on the conversation. So there are people who are saying, just go ahead and legalize it. I'm not so sure that that's the solution, only because I feel like, I don't have an issue with gambling personally. I don't have an addiction. And I think that people probably need to recognize when they do have an addiction and what they need to do to get help for that. And it's unfortunate because I think persons with addictive personalities will always find something to latch onto for their addiction. So even if you make it more difficult for them, they're going to find online gambling, they're going to find other ways. But in my opinion, at least some of those options, for example, online gambling, is going to be a little bit safer because, again, you're not using or you're not getting access to cash in the way that it's happening otherwise, right? So, I would really like to hear what the RCIPS has to say about this. Legalizing gambling isn't something that they can do. That's a political directive. So let's talk about the politicians' role in crime fighting and the police's role. So we want to blame the politicians for everything, and I get it. Me myself sometimes are like, what's the political arm doing? But I think that we need to be realistic about what they are responsible for, what they can and can't do. And when it comes to crime fighting, certainly they can try to put some policies in place as it relates to things and programs that they'd like to see implemented. They fund the RCIPS, so they give them millions of dollars to have the best equipment in the world, to have adequate staffing. But they're not the ones who are sitting down there with RCIPS going, okay, well, you need to go to this location and raid this shop, and you need to do this and you do that. That is outside of their remit. The person responsible for security of this country is actually the governor's office. And so the RCIPS, the courts, these things fall under the governor's office. And so by extension, the governor, in conjunction with the RCIPS, should be telling us what is going to be done for the increase in crime. We've had a real increase in robberies lately. They've all been armed robberies. Now, a few people said, is it the same two guys? I doubt it. The same two guys are not going to be hitting the money services shop in Savannah, going to Eastern Avenue, going to West Bay Road. It's more than two guys out there with a gun. I saw another commenter on Facebook say, where are the guns coming from? Well, we know where the guns are coming from. Hello, we just had a drug boat come in that has how much ganja on the drug boat? It lost 3 of the guys that were on there, by the way. And they are all, the Coast Guard has now said it's no longer a search and rescue, it's search and recovery. So in other words, they got the 900 pounds of ganja and 1 guy, and the other 3 probably have drowned, if what the 1 guy is saying is true. So now they're assuming that they're dead, and they're going to potentially recover their body. I saw the Coast Guard post something on, I believe it was Sunday, where they found 2 life vests in the mangroves. But Caymanians, y'all need to wake up. The vast majority of guns are coming in through the Jamaican route. They're coming in these drug boats. So these drug boats, and again, people say, oh, just legalize the marijuana. Well, let me be very, very clear. Those drug boats are not bringing in just marijuana. That ganja might be one of the things that they're bringing in, but they're bringing in cocaine, they're bringing in weapons, and they're bringing in men who, if you listen to the streets, are going to be here for a little bit, committing some of these crimes, and then they grab the next boat out when they can. And there's a whole business around importing people illegally into this country from Jamaica and some other regional locations. So the word on the street is for $3,000-$4,000, you can secure yourself a weapon on one of these boats from Jamaica. And you can also secure passage in and out of this country by way of our shores. So now this brings me to the Coast Guard, who took over from the Marine unit in terms of patrolling our shores. We need more. Cayman is how many square miles? 28, 29 square miles? Pretty small, really. Right? It's like the Cubans. They come in every single time at the exact same location. Someone said to me yesterday, why are the authorities not setting up surveillance at that location? We're going to talk about them here in a second if we have time. And I'm just like, hey, I'm a little squirrel trying to get one little nut here of understanding. And I don't understand a lot of the things that are happening in this country. But to blame the politicians, someone was saying to me, well, what is Wayne Panton going to do about this? And I said, well, when did Wayne Panton join the task force? When did he join the Coast Guard? When did he start heading up the RCIPS? I think you guys are looking to place blame on the political arm quite irresponsibly. Even when Alden was in power, you would have never heard me say, oh, well, Alden is the reason why there's an increase in crime. Now, if we look at policies that have encouraged criminal activity, whether it's immigration policies, whether it's no teeth in the law when it comes to all these fraudulent and fake marriages of convenience. All of these things add to the mix of why we're having some of the issues that we're having, for sure. But the police need to let us, the people, know what their plan is for addressing the increase in firearms. And naturally, they're going to say, well, this isn't just on them. This is Coast Guard, Border Protection, CBC. So all of these agencies, all of these policing agencies do have to work together in collaboration to try to resolve these issues and to catch the people who are bringing these firearms into the country. Now, once the firearms are here, and they are definitely here, what then is the solution for getting them off of our streets? When was the last time we even had a firearm amnesty? Listen, I'm not saying that's terribly effective, but if you get one or two drugs off the streets through the firearm amnesty, it's a start. We need to have better methods of people ratting people out. Calling a secure number. Half the time, the website information on Crime Stoppers isn't even up to date or accurate. I've had to message RCIPS before and say, can you fix your website, please? Because it's not working. Who am I going to blame for that? I'm going to call Wayne Panton and say, you need to fix the website for the RCIPS? Yesterday, we heard Border Control, because this in part falls under them, say that some of y'all have been scamming the government and the tourism stipend. Well, duh. I mean, that's news to somebody. We've been saying that from when the Progressives was in government. Of course they've been scamming, but here's the difference. When they had that data leak, everybody could see the names. And even to me, with my little four eyes, was like, doesn't this person work for government full time? When was this person in tourism? So there were a number of people. Remember, we were the ones who leaked, or not even leaked. We were the ones who broke the story about prisoners allegedly getting it. And at the time, it was like, oh no, that's not happening. I think, in fact, one MP said, no, somebody might have gone in for a short period of time. And maybe he was thinking of one specific case. Now we hear the truth. And the truth is, some of them were incarcerated. At least one person was incarcerated when they applied and received the stipend. Are you kidding me? Seriously? Sometimes y'all just need to keep your mouth shut, because you be defending stuff and you do not know what you're defending. So their own family members are coming forward and outing them. Oh yeah, this person wasn't working in tourism, or they were in jail the whole time. So what address did this person put down as their address if they were in Northwood? Now, the number that has been set up to out people, I got a phone call yesterday, right after the article went up, and they said, Miss Sandy, I'm trying to call this number, but it doesn't work. Once again, who am I going to blame for that? Premier Panton, is it your fault that a government press release sent out by civil servants has a number for reporting fraudulent activity against the government? So you can catch more of these thieves on that tourism stipend list, and the number doesn't work? So you took time to put together a press release and to send it out, and you still sent it with a non-working number that you want people to call and give you a tip on. What a hot mess. I can't make this stuff up. Let's take a quick break and hear from one of our sponsors.
At Innovative Building Products, we provide professional builders and homeowners with the highest quality materials from top brands worldwide. Tiling tools, waterproofing systems, thin sets, self-levelers, grout, along with porcelain floor and wall tiles. Our products are 100% guaranteed, promise 100% satisfaction, and beat competitor pricing. Pallets of materials are ready to go. Quick and easy convenience to get you in and out within 5 minutes.
All right, folks, Innovative Building Products, do check them out. They're the building industry's best kept secret. 324-1471 is their contact number. and they're conveniently located at 27 Sleepy Hollow Drive. So here's the thing, folks. I can't make this stuff up. This is what's happening. Quite shocking, really, that this is some of the level of incompetence that we're having to deal with. Lindy says that they know who's selling numbers. Marshall says, when I was in Cayman, I used to see certain police officers buying numbers. Yes, police officers are gambling. Politicians are gambling. Church people, they be up in church looking at their phones, at whatever time the numbers play on a Sunday. I don't even know, but I think it's early morning. There's an early number that plays or something. And they'd be in church asking each other what number played, checking their phones to get the latest update. An addiction to gambling is a serious problem. Look at the lady at Turtle Farm who's in court and being accused of Miss Rachel of stealing some, $300,000-$400,000 from the Cayman Islands government. When they went and did a raid in her house, what did they find? All kind of numbers, books, dream books, gambling books. And, she, if you listen to what the street says, she has a serious gambling addiction problem. So all this money she was stealing from government, she wasn't investing it in property or doing something meaningful with it. She was just gambling the money away. Someone says, remember that the commissioner of police is over the Coast Guard. So ultimately the buck stops with him is what this person's saying. What a mess. Unbelievable, really. Unbelievable. Let's read some more of your comments. And don't forget, folks, 936-BOBO, the telephone lines are open for your calls. So Magdalene says, praying that someone buys that bar, flowers or dart. I know we think dart's going to solve all our problems. I love how y'all love to cuss the poor dart organization. But when you want something resolved, you're like, oh, let the dart organization buy it or fix it. Because they have a reputation of doing things a certain way, right? You can say what you want about them, but I'm just saying. Jonathan says government is losing about $3 million a month for not taking the numbers business for themselves. But this is the point, Jonathan. They're not going to take the numbers business in the way that you think. And there's going to be outlays and costs associated with running any sort of legal gambling regime. So you're not going to just be making money, you're going to be spending money too. And, you need to have a look at, we're not going to get too deep into the whole gambling situation, but you need to have a look at gambling addictions in states and jurisdictions that have legalized gambling. Because now you got to be setting up help for people who are going to have ready access to gambling and going to be gambling the family's paychecks away and earnings away and all that kind of stuff. So you can't just say, let's just legalize gambling and not think about the implications that come with that, because you're going to create even more issues than you currently have. So Andrea says, and this is what's going to happen when they shut down these places. They're going to be more criminals, trust me, because they can't juggle their numbers. You'd be surprised how many Caymanians actually living off of buying and selling numbers. Well, I wouldn't necessarily be surprised, but what I'm saying is maybe we need to find some legal work for those individuals. So everything that is problematic to society, right? Gambling, ganja, drugs, whatever. Is the solution just to legalize it? That certainly can't be the answer to everything. Child abuse is horrific and horrible against society. Are we going to just legalize that? Because then that resolves the problem? I think we need to think really, really deep about this, folks. Tons more comments coming in. We do have to wrap up the show for our radio listeners, but we'll continue reading some of the comments on social media. So thank you, everyone listening on Bobo 89.1 FM. We'll be back here tomorrow morning at 7:30 a.m.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels and visit CaymanMarlRoad.com for all the latest news and community happenings.
All right, folks, so let's continue the conversation here. Cameron says, I can remember your Governor Roper, who's in charge of the RCAPS, clearly stating that Cayman prides itself on being a country of law and order. Wonder if his tone has changed now. I'm pretty sure it hasn't, but we need to really get this situation under control. The Ugly Truth said it would be hard to play Christian if you're seen buying numbers at the gas station. Undercover numbers buying makes it easier for those Christians. That's an interesting point, Ugly Truth. So really Ugly Truth says if you legalize it and you see people buying numbers or whatever, the people who hide the most, which are the one-day Christians, or not even full one day, half a day Christians, yes, maybe this might be a deterrence to them because they want to be hiding and buying numbers. But who doesn't know they're buying numbers, Ugly Truth? Again, this is the worst kept secret in all the Cayman Islands. So Jonathan said if they pay $5 more money than what the criminals are paying, they will slip that business right under their feet. Good morning to Miss Sonia. How are you, my dear? Scratch cards, numbers, and national lottery. Carol, thinking how I was just thinking, says legalizing every criminal offense doesn't solve the crime. Ding, 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 ding. I'm going to agree with you, Carol. So Jonathan seems to think, and I think this is again, very rudimentary thinking. We need to follow this through a little bit. That if you take away the source of money away from the criminals by legalizing the gambling, that's going to solve the problem. I'm not so sure actually that it does. Moyen says, well, what the heck? It's already embedded here. So might as well the government control that revenue stream. All that excess money could be used to help fund the NAU budget and the free lunches and after school programs at the public schools. How much of that gambling money is leaving our country now? Might as well grab some of it back and put it to good use. So Damien says it becomes a criminal offense because it's not controlled. So now what number seller is going to be backing guns now also? Doss says a national lottery proceeds to benefit education, which is kind of what Florida did. Andrea says that every tourist comes here, they want to go to the casinos and gamble. Well, it's so interesting that you say that, Andrea, because to me, they're going to the casinos and gambling just like every other location. So once again, Cayman does not become unique in any way when we introduce those elements, right? Good morning, Senor Danny.
Hola, ¿cómo está?
Bien, bien.
That's the extent of my Spanish. You touching some fiery subjects this morning. You're not gonna do something that's gonna do away with crime entirely. But let's just take one of the issues like cannabis, for example. If people hold the view that cannabis should be illegal, then they should also be holding the view that alcohol should be illegal.
Okay. And at one point, alcohol was illegal.
Right. And having alcohol legal doesn't do away with alcoholism.
Right. Yes.
Right. You see, the truth of the matter is the only thing that will help society is when people are individually understand how to make good choices about what they do with their life. You're not going to be able to pass some law that's going to protect someone from thinking, you know what? I think it would be a good idea to drink a bottle of rum every day. How's that law going to stop them? They're going to get it however they feel like getting it. And there's nothing you're going to be able to do to protect that person from themselves except educate them. But that's a much more difficult task to do, because when you talk about doing that, now you're talking about a multi-generational effort. And policymakers, unfortunately, in most instances, are stuck in a 4-year cycle. So there's not a whole lot of multi-generational thinking going on. In fact, when you think so far into the future, they see it as irrelevant to the present. But the action needs to take place now if you want to appreciate the benefit at some future date. By the way, technically, that's the definition of an investment.
Say that again. What's the definition of investment?
To deprive yourself of enjoyment right now.
Oh, right.
In other words, postpone it for a future time. So you put your money in a pension account, for example, and then you have it when you retire. Right? Well, that brings me to the next subject of gambling. The financial industry in the Cayman Islands is just a legal form of taking risk. Now, you use the word gambling because it has a certain connotation, but at the core of all of what's happening is somebody's taking a risk that they could have either a reward or a loss financially. And that's what investment companies do. They take your pension money, they take whatever, and they invest it in the hopes that what they've invested it in will yield a positive return. What if you could say, well, the person who thinks that, like, for example, going to Florida and buying a lottery ticket in a gas station is a great idea. Well, if you have $5 that you can afford to just throw away, then, well, that's not a big deal. When you start taking the baby's milk money and gamble it, you have a problem, right? So again, you have to have people understand that those types of games in that way is effectively a tax on the poor. The problem again is in this situation is the ignorance of people not understanding that. So we're back to education being necessary, right? It would be better if people were to take calculated risks in the form of, let's say, understanding how to properly run a business. Because what you've done with this radio program in itself is a risk as well. Now you're putting in labor, effort, brain power, and all sorts of things to make it happen, but make no mistake about it, you have forked out money, sweat equity, and maybe you get it back, maybe you don't, right? But it's a higher probability that you'll get it back if you work hard. So instead of having people think, well, you know what, I'm just going to buy a ticket and it's going to take care of everything that I need. We need people to understand that the reason why those investment companies are making lots of money, the reason why we have a financial center here is because they understand that there's these strategies by which they can utilize capital in the hopes of gaining a return. And what our people need to do is to take advantage of those opportunities. One of the things that bother me the most is the comment that, oh, there are two things we should never talk about: politics and religion. Well, I watch Bloomberg all the time, and I see I'm talking about politics every hour. So why is it that we don't train our people better to be in these more lucrative industries, where a person is not just merely thinking, I'm going to go and get a job. What's the minimum wage? You need to raise the minimum wage. What about if you think like Sandy did, you know what? I think there's a need. And I think there's a way that I could fund the necessary components of delivering that need. And I could call it a business. And so what if I could do, not necessarily a radio program, but the point I'm making is, what if I could do investments? What if I could buy shares in CUC? What if I could invest in gold, as an example, and other types of instruments, right? Why do we think that what the ticket, pun intended, out of poverty is to buy a lottery ticket? The truth of the matter is that the reason why they are a tax on the poor is because the odds of winning, say, the Florida lottery one, are enormously against you. The reason why people gravitate towards the one that is played locally is because the odds are much greater of winning. Because in Florida, it's one in certain 50 something million, probably. I can't remember what the statistics are now. It's been a while, I haven't looked at it. But the odds of the local one is 1 in 100.
Right.
So obviously your chances are better, but I think it is wrong to think that money that's going out of the country is going out of the country just purely because it is revenues from the lottery, meaning what they talk about, the Honduras or the Jamaican lottery. What is actually happening, as I understand it, is that the people who sell the lottery locally, it's not like they have somebody else that they have to send this money to.
Right.
No, that's theirs. They're a Sandy. They have their own business. It's illegal, but it's a business, right? And it's their money. So if they send it off to buy land, or because they don't think of Cayman as home, or they want to move, or whatever the reason is, they're not sending it off because they need to some central authority. It's because they buy land, they want to build a house or whatever. And so the amount of money that would be made by government but trying to duplicate that, I don't think is worth it. Because when you made a point earlier to someone about the cost that would be associated with setting up such
which
an
by
operation.
the way, the costs which the illegal gamblers don't undertake and don't have. They don't have security. That's why they're an easy target.
Exactly. But it's not just security, though. It'll be things like transparency. You need to have independent audits. Exactly. Whole thing, right?
Yes.
And so when you start putting all of that in, then what is left is you're not going to compete with the illegal lottery. It will remain and
continue
and
to
then
flourish.
Yeah, and then you're back to the point that I made earlier. How do you educate people to understand what are better choices in life?
Exactly.
That's your only hope.
Yeah. Now here's
You're
a
not going to put
comment.
a law in place.
Here's a comment, Danny. I want you to tell me what you think about this one. So Ms. Moya says, well, if government does take it over, then there's a whole lot of jobs for the undereducated Caymanians who are struggling to get a steady job. Example, prisoners who were just released and looking for a steady job to start off with. Now, who in their right mind would take a prisoner and put them in an environment in a gambling house or a lottery type of environment? I mean, if I was running that business, I certainly would never do that.
Well, first
for
of all,
more reasons than one.
It's not a labor intensive operation. And so in order for it to be as efficient as possible, you would have to use a model that's similar to what they do in the US. The reason why you can buy a lottery ticket at a gas station is because there's a cashier there anyhow, right? So it's not, you're not setting up a cashier specifically to sell lottery tickets.
Right.
It's just another service that's sold in a gas station. So and in order to have the efficiencies, then the numbers being drawn would have to be done in a mechanical, unbiased, truly random sort of way, which then means that you're talking about a machine, which means, just a few highly trained individuals, but not a bunch of laborers. Right? Because then your cost goes through the roof. And that's not gonna cut it when you're trying to have a large pot to divvy up if somebody wins. It doesn't work that way. They have a skeleton staff, automation, and then they utilize distribution points like stores and stuff to, get it to the customer.
Now, let's say that, you potentially wanted to open up a casino. If you were a casino owner, and this is a question for you, would you want to hire someone who just came out of prison and who's underemployed or under, not much skill set? Would that be your first candidate for someone working in your casino?
Well, I would want someone like that on the payroll, but not as many as people would think you would want to have, because you need a criminal to help you understand the criminal mind. So if you want to deal with fraud in your facility, then you need someone to assist you with how criminals think. Because the truth of the matter is, the reason we're having this discussion is because a lot of these comments are comments from the minds of law-abiding citizens trying to make decisions about what would be rational, and criminals don't operate like that. And
all right,
so
one final question for you.
I want to make one statement since we're on this thing about casino. It's something that's been said in the past that should be done in Cayman, and some of the things it said is, oh well, Caymanians wouldn't be allowed to come in as a measure of, protecting the local population, but tourists would be able to utilize those services. I fundamentally disagree with that. Let me tell you why. What it's saying, the principle that you're establishing, is that you're saying it's a good idea to set up a type of business to which Caymanians are not allowed. Imagine that for a second. You think the black laws were bad? That's a terrible idea. I know.
One final question here for you, Denny, is where do you think, and I know you're a member, I believe, still of the Cayman Islands Gun Club, and you've been a firearm owner for many, many years. You've got a lot of people, contacts in law enforcement. Where do you believe the illegal firearms are coming from that come into this country. The vast majority of them, if you had to just pick one location, because I hear people arguing with me, feeling that I'm picking on Jamaica, and I'm not picking on Jamaica. I'm just telling you the cold hard facts. I'd be wagering to say 85 to 90% of the weapons that come into this country are coming in through that route. Yes, have we had firearms come through a container from Miami? Yeah, I know of we all know of that one case. The U.S. authorities sat back and allowed it to come, and then those individuals got arrested. I don't think they were very successful in prosecuting them on this end, but in the U.S. they nabbed a couple of them and they sat in jail for a little bit. But if you had to pick a single location of where from your firearm knowledge and experience of where weapons are coming in from, where would that be? Am I off on the money here?
Well, it's actually the Cayman Islands Sports Shooting Association. It was called the Cayman Islands Gun Club previously.
Thank you for the correction.
But I agree with what you're saying about where it's coming from. But in order to understand that better, I think you need to understand that guns, illegally owned guns, as an associated industry, or more appropriately in the context of drug trafficking, as a currency. Right. So it's not but this is why, and this I didn't get to address this part, forgot it earlier when I was talking about cannabis, is that if you understand it as associated with drugs, right, and it being a currency that criminals pay other criminals for their supplies, then it's easier to then for the person who says, "Oh no, it's not coming from Jamaica," to think about, well, if you ask yourself, where is the cannabis coming from? Well, the guns are going to come from the same place, right? And so because they are, it's currency in the drug trade, right? But the thing that I want to say is that while legalizing cannabis would not do away entirely with the criminal element of it, if it was accessible and lawful for people to purchase it locally or even grow it themselves, what you do is you significantly reduce how much of it will come from abroad, and as a result of that, reduce the need for the associated currency that go along with it, firearms. And so, no, you're not going to stamp it out entirely, because there'll be some people who will want it and wait just because of where they work, for example. In other words, if you make it legal, regardless of the fact that it's legal, some businesses will say, well, I don't want my employees doing that anyhow, because I think it will impair their ability to do a good job. And so they will have a policy that if you want to work for me, you can't do this. And so them going to buy it legally jeopardize their job. So they'll still buy it illegally. But most people would buy it legally than illegal if they had the choice. Which brings us to another point. How, you see, smoking is how people typically think of the cannabis use, but it's not the only way in which it can be consumed. For example, what the substance THC that would cause a person to be high, so to speak, is not present in the plant in its natural state. So, for example, if you took the plant and you made a juice, for example, right, or ate it as food, like as part of a salad, what you get is the cannabinoids and the flavonoids that are present in the plant itself for nutrition without any of the high associated with it. The reason for that is that the only time you will get the THC affecting you is if you expose the plant to heat. The chemical reaction that takes place as a result of heat converts what's called THCA, which is an acid, precursor acid, into THC, and it's only after it's applied to heat is applied do you get the high. So you can actually consume the plant naturally without any high at all, zero.
Jonathan saying we don't need the science, man. So this is where Jonathan and Damien, they want to thank you and they want to listen to you, but only up to a point. When you start to make logical and scientific sense and say don't smoke it and you're not doing it for the high, then they don't want to have that conversation. But Denny, let me pause you there only because I think we are going off on a tangent just a little bit. We can have a discussion on marijuana on a completely separate day because I think it is a valid discussion that needs to be had.
Well, I was seeking about my comments was trying to get to the point where people understand how if you legalize cannabis, you reduce crime. You won't eliminate crime, but you will reduce it because you reduce the demand. And because the crime of selling cannabis or illegally importing cannabis is a business, that business will not have the demand for it because it will be produced locally. So I was just trying to give you an example of how local consumption is not limited to smoking, right?
And do we have
diet.
I don't want you to answer this question now because we do have to go, but when we circle back to this conversation, what I would like is your actual real world evidence to support that position. So which countries or jurisdictions have legalized a drug, whether it's cannabis or anything else, and that has led to a reduction of crime? So that's where I want you to bring me back the research that actually proves that point, because that's ultimately the reason why we're legalizing it. We're not legalizing it just because we want people to walk around smoking pot all day long, right? If we're saying that legalizing certain activity, whether it's cannabis smoking, gambling, or anything else, actually helps the core problem, then there should be tons of evidence out there to support that position. And so that is where I want to go with this. It makes me think of prescription drugs. Prescription drugs are legal once you get them through the right avenues from a physician who's going to monitor how much you're getting, so on and so forth. But we see there's an entire illegal prescription drug market, whether it's fentanyl or anything else, that is completely out of hand. That doesn't seem to be impacted by the fact that physicians can write prescriptions every single day. So let's talk about it some more. Thank you, Denny, for your contribution as always.
All right. I just wanted to say that the difference between fentanyl and cannabis is that.
Well, no, I'm not comparing the two drugs, but
no. But I'm just saying that I'm not talking. It doesn't have to be fentanyl. It could be any other drug. The difference is that you're not simultaneously saying it would be legal in your country to just use that as an example to produce that. But if it is, then the external demand decreases. And so the associated industry of firearms to that illegal importation decreases. Unless people are just simply traveling here to commit robberies for no other reason.
And you do know that that's an entirely separate market as well.
I do.
All right, leave it there.
All right, bye.
Thank you so much, Jenny. Appreciate it. All right, folks, that's the end of our program here on social media as well. It's just about 10 o'clock. Let's go ahead and wrap it up. Thank you guys so much for the lively discussion. Jamie, Jonathan, Damien, I was combining your two names there for a second. Miss Donna has a question. She says, how do you term a criminal different from someone who made a mistake and got a 6-month sentence in prison? Well, they're still a criminal, Miss Donna. So I think I keep stressing this. And I've got a neighbor who says, Sandy, I really like when you correct people to say it's not a mistake, it's a decision, it's a choice. So you might have made a poor decision, a poor choice, and maybe you'll never make it again. But if you did it, you did the crime, you're going to do the time, and hopefully you learn from your decision. Not a poor mistake, but you learn from your decision, and then you move on from there, but you're still termed a criminal either way. So I think that this desire for us to somehow differentiate, and there are a lot of people who will make a decision that they're like, oh man, I could kick myself. I shouldn't have done that. I shouldn't have stolen. I should have, killed and shot a man in the head. Hello. Is that any different than lesser crimes? Well, it's a lesser crime. If you get 6 months, chances are it's a lesser crime. But let's keep in mind that there are people who will take somebody's life after deciding to drink and drive, for example, and get less than 6 months. Does that mean that they're not a criminal? Does that mean that somebody's not dead? It really doesn't. The impact of their actions are still very much felt by a community, especially as small as what we have here in the Cayman Islands. So one more person weighing in, and they say if you legalize gambling, then you could have casinos visited by cruise shippers for the day. But at least you could create revenue for paying for the problems. At the moment, the revenue is not the government's, and therefore it cannot be directed to who need it. So again, we need to look at those models to see if those models actually work. Damien says necktie should be part of a prison uniform. Folks, the bottom line is, as this person has just sent in their comment, they said the question people should be asking is, why isn't the governor and the commissioner doing more to reduce crime? Well, we're going to ask them. We're going to email them this morning, both of them, and invite them onto the program so that we can hear what their plans are to increase this, to address the increase in recent robberies, the increase in gun importations. I don't necessarily care where they're coming from, but if they're coming from one particular location and those drug boats are where the majority of guns are coming from, then that's a problem. And they enter this country illegally. Somebody mentioned, they're coming in on the fishing boats, right? If they're coming in on the fishing boats are subject to a search by customs. It's going to be a lot easier to find illegal weapons in that sense than people who come in under the cloak of darkness into our waters. I'm just saying, that's just logic, 100%. So we need to address these problems, folks. I think we're all on the same page in terms of that. But, at the end of the day, let's put our collective heads together and really see what we can do about this. Again, our condolences to the family of Mr. Harry. It's a horrific way to have to die. Damien says, why can't they do more patrols 10 to 20 miles out from sea? A lot has to be done, I think, to beef up the security of our borders for sure. And we see the trickle-down effect. And the trickle-down effect includes, I don't remember where someone posted this, but they said, listen, we ourselves, this might have been in the comment section here, we ourselves are to blame for this. Because a lot of times, it's our family members and people that we know. Oh, yes, Marshall says people need to blame themselves. A lot of them know who's doing what. So we have family members and we aren't saying anything. And I think that that's true. You become part of the problem when you cloak up your children in your household and you know that they're out there robbing and stealing and whatever, and you're not turning them into the police. Be that parent that is going to put your foot down and say, I don't care if you're my child, if you're my nephew, if you're my grandchild. If you're out there doing wrong and you're harming other people, then you need to be in jail, whether it's 6 months or 6 years. You need to be taken off the streets. And if you have an addiction problem or you need help, hopefully you can get the professional help that you need in that space of time as well. All right, good folks. Once again, thank you all so much for tuning into the program. Appreciate your continued support. Tomorrow is Wednesday, so we will have Impact Wednesday on. We're hoping to have the Minister of Health on the program. Tomorrow evening, the Premier is actually traveling and he's off island, so I'm not quite sure yet who tomorrow evening's guest will be, but I will certainly keep you guys updated on that front. And until then, have yourself a fabulous and productive Tuesday.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels and visit CaymanMarlRoad.com for all the latest news and community happenings.